Welcome to Healthcare Rounds, the podcast serving you the ins and outs of health policy and business topics, as well as our take on the rapidly evolving healthcare delivery ecosystem. I'm John Marchica, founder and CEO of Darwin Research Group and host of this podcast. To learn more about us, go to darwinresearch.com. A trove of data and new research on accountable care organizations was recently released. This week's Our Take tells you what you need to know. First, in late August, the National Opinion Research Center, or NORC, at the University of Chicago, released the results of the first performance year in 2016 for CMS's next generation ACO model. In 2016, there were 18 active NG ACOs, comprising 31,000 providers and nearly 500,000 aligned beneficiaries. The average NG ACO served about 25,000 beneficiaries. According to NORC's research methodology, NG ACOs reduced aggregate spending by $100 million, or about $18 per beneficiary per month. Of the 14 NG ACOs that had shared savings, 4 of them represented more than half of the savings. Much of the savings was attributed to reduced spending on post-acute care, particularly on spending at skilled nursing facilities. The researchers found statistically significant reductions in the number of inpatient hospital days and non-hospital evaluation and management visits per month, as well as increases in the number of annual wellness visits among NG ACO providers. The researchers noted that, quote, primary care providers are critical to value-based purchasing models because of their focus on preventive care and comprehensive care management. Alongside strong relationships with providers and strategic composition of provider networks, partnerships with skilled nursing facilities and other post-acute care facilities may be an important component to success. Also in late August, CMS released its MSSP ACO public use data file for 2017, which includes financial performance and quality scores for 472 ACOs, representing nearly 9 million beneficiaries. MSSP ACOs had shared savings in 2017 of $1.1 billion, or about $185 per beneficiary. After factoring in the bonuses paid to MSSP ACOs, the program saved Medicare an estimated $314 million. In total, 162 ACOs, or about 34%, generated shared savings, while only 11 had shared losses. According to a new study published in the New England Journal of Medicine by Harvard Medical School researchers, physician group ACOs outperformed hospital-integrated ACOs during the first 3 years of the MSSP program. Using research methodology similar to the NORC analysis of NG ACOs, the researchers analyzed differences in savings during the 3-year period between hospital-integrated ACOs and those led by physician groups. Their conclusion was, quote, spending reductions in physician group ACOs constituted a net savings to Medicare of $256.4 million in 2015, whereas spending reductions in hospital-integrated ACOs were offset by bonus payments. The researchers also found that physician group ACOs' performance improved with experience. In 2015, physician group ACOs that started in 2012 had $474 in savings per Medicare beneficiary, compared with $342 for those starting in 2013 and $156 for those starting in 2014. Here's our take. The NORC study suggests that NG ACOs rooted in an integrated delivery system, or IDS, may outperform those based in a physician group. Quote, an IDS may offer greater capacity to support care coordination and management across settings as its organizational features, for example, governance structure, health IT and analytic systems, may be less fragmented than non-IDS ACOs, end quote. That contradicts the findings from the Harvard study, which found that physician-led ACOs are outperforming IDS-based ACOs. However, the NORC researchers noted that IDS-based NG ACOs in their sample had more years of experience than did those anchored by a physician group.